So we were expecting it, but of course the news last night that we are now officially in a third wave of COVID-19 was very troubling to hear. Gauteng is not only driving those national figures, but also facing serious problems with several health facilities. And while we are getting used to hunkering down and riding out the peaks and waves of this virus, there are new elements to consider. And I'm joined now by Professor Salim Abdool Karim, Director of Caprisa, that's the Centre for the AIDS Programme of Research in South Africa, and he is also, of course, a member of the WHO's Science Panel. Prof, thank you so much for your time this evening. I want to ask you if you can give us any insight into the news coming out of the USA. The FDA seems to have made some sort of decision around those Johnson & Johnson batches that were held back and inspected because of that mix-up at that Baltimore factory. So I'm just going to run through the chronology of what we've heard this evening to bring everyone up to speed. First of all, we saw a New York Times article that was headlined, "The FDA tells Johnson & Johnson to throw out about 60 million doses made at troubled plant." The article also says about 10 million doses can be used, but they'll have to have some sort of warning, and it'll be up to the regulators in each country to decide. This, of course, was before any FDA announcement. And just about an hour ago, we did get a press release from the FDA saying they've taken steps to increase availability of COVID-19 vaccines. And they say that they have now decided to allow a critically needed supply of Johnson & Johnson vaccines to be made available. They say that 2 batches of vaccine drug substance manufactured at that Baltimore plant can be made available. They are suitable for use. But they also say, further down, they've determined several other batches are not suitable for use, and they're also testing additional batches. We have been trying to get hold of health authorities. I don't think it's clear at this point what it might mean for South Africa. What is your assessment based on the kind of information that we're getting so far?
Yes, very good evening, Sally, and good evening to all of the viewers. I think the whole episode at Emergent, which is the company in Baltimore that makes the drug substance for the vaccines, has been really a very unfortunate and very difficult situation. When we look at the way in which drugs have to be approved, the factory in Baltimore operates under the oversight of the FDA. And so any drugs that are made at that particular factory, at Emergent, has to be approved by the FDA. And the FDA is concerned about any of the product, then we have to accept that if it's not good enough for the FDA, then it shouldn't be good enough for us. And so we have to work on that basis, because we don't have our own people going and inspecting that factory and assessing what that situation is. It's going to be a huge knock, because South Africa has been banking on those J&J vaccines. Not only South Africa, actually the African Union has been banking on 220 million doses of J&J, and this was an important part of the first batch of those doses. So this is going to be a huge knock for the vaccine rollout in much of Africa, including South Africa.
Yeah, it doesn't sound like great news, and it does seem, just reading from the FDA release, and it says, and I'm going to read you it verbatim, it's also revised the letter of authorization for the J&J vaccine to help facilitate potential export. Under that revised letter, the distribution and administration of exported vaccines must comply with the laws of the recipient countries. Does that suggest that those vaccines that are released, basically it's going to be up to the country to say, well, yes, we're prepared to risk it, but the FDA is saying you do that at your own risk? Am I interpreting that correctly?
So I'm not fully aware of exactly how the jurisdictions work, because there's a certain amount of risk that's involved. And if the FDA is approving something, or if the FDA is saying, okay, we're washing our hands of this, it depends on a local regulator, then it's up to our local regulator to make a determination of the risk. It's hard to see how they will do that, because they're not familiar, they haven't done an oversight of the actual plant in the US like the way the FDA has in great detail. Because remember, the J&J vaccines that come from the Eastern Cape were actually manufactured in that plant in Baltimore. They're just being bottled and formulated in the Eastern Cape. So the actual drug substance is from the US. So I think if the FDA is saying, okay, countries can run their own risk, then that's something that the SAHPRA will need to take into consideration and determine that it will set some criteria to make a determination as to whether to proceed.
All right. Well, thank you for giving us your insights. Let's talk about the third wave across the whole country, but Gauteng certainly leading it, unfortunately. Do you think that this province is in for the worst wave yet?
When we look at the way in which the first wave and the second wave came, they generally start in one or two provinces, and then from there extend to other provinces and eventually, cover the entire country. So the first wave started off in the Western Cape, and it sort of meandered along, and then after a few weeks it spread to the Eastern Cape and then to the rest of the country. In our second wave, the second wave started in the Eastern Cape, extending to the parts of the Western Cape and then spread to the whole country. This wave has its origin, the ground zero of this particular wave seems to be Northern Cape, Free State, and Gauteng. And Gauteng is now, when you look at its trajectory, is on a trajectory that's very similar to the second wave. If it follows that trajectory, it's very likely it's going to see this third wave that's going to be in the order of what it saw in the second wave, which was quite a severe wave because we had a new variant, the cases were rising rapidly, the variant spreads faster. So we can expect that over the next week, week and a half, 2 weeks, the cases are going to continue to rise, and they're going to rise quite rapidly in Gauteng, because that's the way in which the trajectories have worked in the past. So if it follows that trend, that's what we can expect. But the other provinces, the Western Cape, the three coastal provinces, Eastern Cape and KwaZulu-Natal, they are running about 3 to 4 weeks behind. So their peaks will be coming up as the Gauteng peak is on its way down. And so that's what it looks like if you look at the picture in our country as a whole.
Yes, and we have been told by Professor Bruce Malado, that we're likely to peak with our third wave here in Gauteng sort of early July. Do you think we should be looking at restrictions, tighter restrictions in our province already?
I think that the current restrictions that we have are not adequate to keep the kinds of cases that we want to keep the numbers down to. Let me give you, two very simple issues. The first is that, gatherings are really such a critical part of the equation. They play such a central role in the spread of the virus. So we've got to have quite severe restrictions on gatherings. And right now, our gatherings are just too lax. At allowing 100 people indoors is, in my view, we should be having something a lot more stringent. The second is that people have to have some kind of signal that says we are in a serious situation, because we are. It might not be evident to people in some provinces because they haven't seen the cases there and they haven't seen their neighbors falling ill and their family members. But the reality is that our country is going into a severe third wave. And the government and our own actions and civil society, we've all got to raise our own game and make sure, we use our protection measures. So this thing about, 1/3 of people walking in the street are walking without masks really shouldn't be the case. We really need to be sending that signal that we've got to make sure that we reduce our mobility, we increase our protection measures, and we get ready to buckle down because this third wave is upon us.